Every year, millions of older adults walk into a pharmacy and pick up the exact same small white pill. Their doctor told them it was good for their bones. Their friends take it. Their mother probably took it too. And almost nobody warns them about what it might be doing to their arteries while it protects their skeleton. I'm with Health Insight, and after looking closely at the research on this, I have to tell you something that surprised even me. The pill millions of seniors take every single morning for stronger bones may be quietly raising their risk of heart attack and stroke. Not by a small margin either. We're talking about numbers from randomized, placebo-controlled trials involving tens of thousands of people. Stay with me, because by the end of this video, you'll know exactly how to tell if you're at risk and what to ask your doctor before your next refill. Before we get into it, do me a favor. Drop your age in the comments below and tell me this. Do you take a calcium supplement every day? I read every comment, and what you share here helps the next person watching figure out if this applies to them too. Let's start with the pill itself. Calcium supplements are some of the most commonly recommended supplements for people over 50, especially women after menopause. The logic makes sense on the surface. Bones are made of calcium. Bone density drops as we age. So doctors and pharmacists hand out calcium tablets to slow that down. In some countries, up to 7 out of 10 older women are taking one daily. Here's what almost nobody explains at the counter when you pick up that bottle. Your body doesn't treat a concentrated dose of calcium in a pill the same way it treats the calcium that comes from your food. When you eat a piece of cheese or a serving of leafy greens, the calcium absorbs slowly, alongside dozens of other nutrients, fats, and fibers that help regulate how your body uses it. When you swallow a 500 or 600 milligram tablet, your bloodstream gets hit with a sudden spike of calcium all at once. Your body has to do something with that spike, and it doesn't always go where you want it to go. This is the part that matters most. Researchers looked at calcium intake from diet and from supplements separately, tracking older adults for 10 years. What they found was telling. Higher calcium intake from food was linked to less hardening of the arteries. But once you accounted for total calcium intake, calcium that came specifically from supplements was linked to more calcium buildup in the coronary arteries, the very arteries that feed your heart. Same mineral, same number on the label, completely different effect on your body, depending on whether it came from a plate or from a bottle. Think about how differently those two things actually move through you. A glass of milk or a serving of sardines releases its calcium slowly, mixed in with protein, fat, and other minerals that all compete for the same absorption pathways in your gut. Your body sips it in over an hour or more. A tablet is different. It dissolves fast, and a large chunk of that 500 or 600 milligrams can hit your bloodstream within a narrow window, sometimes inside 30 to 60 minutes. That's not a small technical detail. It's the entire reason researchers started looking at supplements and foods separately in the first place, instead of just asking how much total calcium someone consumed in a day. Let me explain why that spike matters. Because once you understand the mechanism, this stops sounding strange and starts making sense. It's the difference between a slow, steady stream and a sudden rush, and your body's internal regulators respond very differently to each one. Think of your arteries like flexible garden hoses. When they're healthy, they're soft and stretchy, expanding and relaxing with every heartbeat. Calcification is what happens when calcium starts depositing into the walls of those hoses, the same way hard water leaves mineral buildup inside old pipes. The hose gets stiffer. It loses its ability to expand and contract. Blood has to push harder to move through it. When you flood your bloodstream with a large, fast dose of calcium from a supplement, some researchers believe that excess calcium doesn't always make it into your bones the way you'd hope. Instead, some of it can end up depositing in soft tissue, including the smooth muscle lining your blood vessels. Over months and years of daily supplementation, that buildup adds up. There's also a second piece of this puzzle that rarely gets explained. Your parathyroid glands, 4 tiny glands sitting near your thyroid, exist specifically to keep your blood calcium inside a narrow, stable range. When a supplement causes calcium to spike, those glands sense it and briefly pull back on the hormone signals they'd normally send to manage calcium balance throughout the day. Do that once and your body adjusts fine. Do it every single morning for 10 or 15 years, and some researchers believe that repeated pattern nudges the system toward depositing calcium in places it was never meant to go, including the lining of blood vessels that are supposed to stay soft and pliable for life. It's a slow, repetitive nudge rather than a dramatic one-time event, which is exactly why it can go unnoticed for so long. This is not a fringe theory from one small study. It shows up across a body of randomized controlled trials, which is the strongest kind of evidence we have in medicine, because participants are randomly assigned to take the supplement or a placebo, and researchers track what actually happens to their hearts. One major meta-analysis combining multiple of these placebo-controlled trials found that calcium supplements increased the risk of heart attack by roughly 27 to 31%, and increased the risk of stroke by roughly 12 to 20%. And here's a detail that surprised the researchers themselves. Taking vitamin D alongside the calcium did not cancel out this increased risk. The combination most people think of as the safe, complete bone supplement still carried the same cardiovascular signal. A separate meta-analysis pooling 13 double-blind, placebo-controlled trials with close to 30,000 participants combined found that calcium supplements significantly raised the risk of cardiovascular disease by about 15% in healthy women past menopause, the exact population most often told to take these supplements in the first place. These aren't small, obscure papers buried in a journal nobody reads. They're large, pre-registered analyses pooling data from multiple countries, multiple research teams, and tens of thousands of patients combined, specifically designed to filter out the kind of noise and coincidence that can mislead a single small study. When independent teams of researchers using different statistical methods, working with overlapping but not identical sets of trials, keep landing in the same general range, that consistency is exactly what makes this worth taking seriously rather than dismissing as a fluke. There's one more study worth mentioning because it illustrates just how serious this can get in a high-risk group. A trial that randomized frail older adults into 3 groups, a control group, a daily sunlight group, and a daily sunlight plus calcium group, found that adding calcium to the regimen nearly doubled the risk of cardiovascular death compared to sunlight alone. That's not a subtle statistical shift. In a population that was already medically fragile, the calcium addition stood out clearly enough that it's hard to wave away as coincidence. Let me say clearly what this is and what it is not. This is not proof that calcium itself is dangerous. Your body absolutely needs calcium, and there are entire organ systems, your heart muscle included, that cannot function without it. This is also not a reason to panic or to stop a medication or supplement on your own today. What this is a pattern that has shown up in study after study, strong enough that major researchers and even institutions like the Mayo Clinic now flag it as a real, ongoing question that deserves a conversation with your own doctor. I want to walk you through what the science says about where the real risk lives, because the picture is more specific than calcium is bad. First, dose matters enormously. The studies that found the strongest signal for increased cardiovascular risk involved supplemental doses of 1,000 milligrams a day or more, taken as a separate pill on top of whatever calcium a person was already getting from food. That is a very different situation from getting your calcium primarily through dairy, leafy greens, and fortified foods, where your body absorbs it gradually throughout the day in small amounts. A multivitamin with a small amount of calcium folded into a broader formula is also a different situation than a dedicated high-dose calcium tablet taken specifically to protect bone density. The research that raised these concerns was looking at that second category, not the first. Second, who you are matters. The clearest signal in the research is in healthy postmenopausal women without a diagnosed calcium deficiency, who were taking the supplement purely as a precaution. If you have been formally diagnosed with osteoporosis or a true calcium deficiency by blood work, the calculation is different, and your doctor weighing the bone benefit against this cardiovascular signal is exactly the kind of personalized decision this video can't make for you. This is not medical advice telling you to stop anything. It's information to bring into that conversation. Men are generally prescribed these supplements less often than women, but the same underlying biology applies if a man is taking a high-dose calcium supplement daily for bone protection. Third, kidney health changes everything. If you have chronic kidney disease, your kidneys lose some of their ability to regulate calcium and phosphate properly, and the calcification risk from supplemental calcium is generally considered more serious in that group. If that's you, this conversation with your doctor is not optional, it's essential. Now let's talk about what the research says is actually happening at the level of your blood vessels, because I think seeing the full mechanism helps this stick. Your parathyroid gland is constantly monitoring the calcium level in your blood, almost like a thermostat. When you take a big dose of calcium all at once, your blood calcium briefly spikes, and your parathyroid gland temporarily eases off the signals it normally sends. Over years of repeating that spike daily, some researchers believe this contributes to calcium being directed into places it shouldn't accumulate, including the smooth muscle cells lining your arteries. Those smooth muscle cells, under enough calcium pressure over time, can actually begin behaving more like bone-forming cells, depositing hard mineral into a place that is supposed to stay soft and flexible. That is the mechanism researchers point to when they talk about arterial calcification from supplements. It's a slow, cumulative process, which is exactly why someone can take a calcium pill every morning for 10 years and have no idea anything has changed until a scan or a cardiac event reveals it. Here's the encouraging part, and it's the reason I made this video instead of just leaving you with a scary headline. This is almost entirely something you can act on with information, not fear. Here's what the research suggests as a more heart-conscious approach to your bone health. And again, none of this replaces an actual conversation with your physician about your specific bones and your specific heart. 1. Get your calcium from food first whenever you reasonably can. Dairy products, fortified plant milks, leafy greens like kale and bok choy, canned fish with the bones like sardines, and almonds all deliver calcium in a slower, more spread out way that the research has not linked to the same cardiovascular signal. 2. If you and your doctor decide a supplement is still necessary, ask specifically about the lowest effective dose rather than defaulting to a high, generic, one-size-fits-all amount. Many people are taking far more supplemental calcium than they actually need on top of what they're already getting from meals. It's worth sitting down once, even informally, and roughly tallying a typical day of food. Many people are surprised to learn they're already close to their target before the supplement is even added. 3. Ask your doctor whether splitting your supplement dose, rather than taking it all at once, makes sense for you. Some clinicians believe smaller, spread-out doses may be gentler on this spike and deposit mechanism, though this is an area where you should rely on your own doctor's judgment for your specific situation rather than a blanket rule. The same total amount of calcium, taken in 2 smaller doses with meals instead of 1 large dose on an empty stomach, may move through your system in a way that more closely resembles how dietary calcium behaves. 4. If you've been on a daily calcium supplement for years and you have any known risk factors for heart disease, mention this research at your next appointment and ask whether a bone density scan, alongside a simple conversation about your cardiovascular risk factors, makes sense before you continue the same routine for another decade. A coronary calcium scan, a quick and widely available imaging test, can give your doctor an actual picture of what's happening in your arteries rather than relying on guesswork. 5. Never stop a prescribed supplement or medication on your own based on a video. Bring this information in and let your doctor weigh it against your blood work, your bone scans, and your full medical history. The goal here is a better informed conversation, not a unilateral decision made alone at home. Let me bring this together with someone I'll describe simply, without using a name, because her story reflects a pattern I've seen referenced again and again in this research. A woman in her late 60s, recently diagnosed with mild bone thinning, was told by her doctor to start a calcium supplement and largely left to manage the rest herself. She took it faithfully every morning for years, never once connecting it to anything happening with her heart, because nobody had ever framed it that way for her. She did everything she was told. She set a reminder on her phone. She never missed a dose. From her perspective, she was doing exactly what a responsible patient should do. It wasn't until a routine cardiac screening years later flagged some early calcification that the conversation even came up. Her cardiologist asked a simple question, almost in passing. What supplements are you currently taking, and at what dose? That single question opened up an entire side of her health nobody had connected to her bone care before. When she eventually brought this exact research to her doctor, they discussed switching part of her intake to food sources, lowering her supplement dose, and keeping an eye on her cardiovascular risk factors going forward. Her bones stayed protected. Her heart conversation simply started a few years earlier than it otherwise would have, which is exactly the outcome you want instead of finding out the hard way. That's the whole point of bringing you this information, not to scare you away from a pill, but to make sure the full picture, bone health and heart health together, is actually on the table when these decisions get made, instead of only half the picture being considered while the other half waits quietly in the background. Let me also address the disagreement in the science honestly, because I promised you real, evidence-based information, not a one-sided scare. Not every study agrees. The Framingham Heart Study, a long-running and highly respected research project, looked at calcium intake and coronary artery calcification, and did not find that overall calcium intake was associated with increased arterial calcification in their population. Other reviews, looking at the totality of evidence, have noted that the link between calcium supplements and cardiovascular risk remains debated, and that some studies on calcium plus vitamin D combined have not shown the same increased risk seen in calcium alone trials. Part of the disagreement comes down to how different studies are designed. Randomized controlled trials, where researchers assign people to take either a supplement or a placebo and then watch what happens, are generally considered stronger evidence than observational studies, where researchers simply ask people what they're already taking and track their health over time. Observational studies are useful, but they can be muddied by the fact that people who choose to take supplements often differ from people who don't in other ways too, like diet, exercise habits, or how often they see a doctor. That's part of why the randomized trials, the ones specifically built to strip out those other differences, are the ones carrying the most weight in this particular debate. So here is where the science genuinely stands today. The randomized placebo-controlled trials, which carry the most weight in medical research because they isolate cause and effect, lean towards showing increased cardiovascular risk specifically from concentrated calcium supplements, especially in healthy postmenopausal women without diagnosed deficiency. Some large observational studies looking at broader populations have not found the same signal as clearly. The honest, responsible answer is that this is a real, active area of research, not a settled fact in either direction, which is exactly why it belongs in a conversation with your own doctor rather than a decision made from a video alone. I think that honesty matters more than a tidy ending. Medicine is rarely as simple as one pill, one outcome. What we do know, confidently, is this. Where your calcium comes from appears to matter. Food-based calcium has not shown this same cardiovascular signal. Concentrated supplemental calcium, especially at higher daily doses, has shown it repeatedly across multiple well-designed trials. That distinction alone is worth bringing to your next appointment. I want to speak to you directly for a moment, the way I'd want someone to speak to my own parents. You are not in trouble for taking a calcium supplement. You were following advice that made sense, given for a real reason, by someone trying to protect your bones. Bone health matters. Falls and fractures are genuinely dangerous for adults over 60, and undertreating osteoporosis carries its own serious risks, including a real risk of losing independence after a serious fall. This isn't about choosing your bones or your heart. It's about making sure both get equal attention in the room, instead of one being assumed safe by default while the other quietly gets a checkup. I see this pattern often in medicine, not just with calcium. A treatment gets established as routine for one part of the body, decades pass, and the conversation about how that same treatment touches other systems in the body never quite catches up to the original habit. Nobody's hiding anything from you on purpose. It's simply that medicine moves in pieces, one specialist focused on bones, another focused on hearts, and the bridge between those two conversations sometimes depends on you bringing it up yourself. So here's what I'd like you to do this week. Look at the supplement bottle in your cabinet. Check the dose listed on the label. Write down, roughly, how much calcium you're also getting from your typical meals in a day. Things like milk in your coffee, a slice of cheese, a serving of yogurt, or greens at dinner. And bring both numbers to your doctor or pharmacist, along with the simple question, given my bone health and my heart health together, is this still the right dose and the right source for me? That one question, brought into a 5-minute conversation at your next visit, could matter more than anything I could tell you through a screen. Now I want to hear from you. Did you know about this connection before today? And are you going to bring this up at your next appointment? Tell me in the comments below, and tell me your age. Someone reading the comments tomorrow might be the person who needed to see exactly that.
And before you go, there's another everyday habit tied to heart health that almost nobody questions, something most people do every single morning without a second thought. I'll break that one down for you in the next video. I'll see you there.